ਸਾਰਿਆਂ ਨੂੰ ਪਿਆਰ ਭਰੀ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ। ਔਰ ਮੇਰੇ ਵੱਡੇ ਵੀਰ ਜਿਹੜੇ ਇਸ ਵੇਲੇ ਸ਼ਿਕਾਗੋ ਤੋਂ USA ਤੋਂ ਸਾਡੇ ਨਾਲ ਹੈ, ਡਾਕਟਰ ਵਿਨੇ ਨੂੰ ਗਲਵਕੜੀ। ਡਾਕਟਰ ਸਾਹਿਬ ਤੁਹਾਡੀ ਜਿੰਨੀ ਵੀ ਤੁਸੀਂ ਥੋੜ੍ਹੀ ਜਿਹੀ ਗੱਲ ਕੀਤੀ ਹੈ ਉਹ ਸੁਣ ਕੇ ਨਾ ਜੀ ਮਤਲਬ ਜਿਵੇਂ ਦਿਲ ਨੂੰ ਛੂਹਣ ਵਾਲੀਆਂ ਗੱਲਾਂ ਕੀਤੀਆਂ ਤੁਸੀਂ, ਅਤੇ ਸਾਨੂੰ ਬੜਾ ਮਾਣ ਹੈ ਤੁਹਾਡੇ 'ਤੇ ਡਾਕਟਰ ਵਿਨੇ ਕਿ ਤੁਸੀਂ ਇਸੇ ਕਾਲਜ ਤੋਂ ਪੜ੍ਹ ਕੇ ਔਰ ਇਸੇ ਹੋਸਟਲ 'ਚ ਰਹਿੰਦੇ ਹੋਏ ਤੁਸੀਂ ਇੱਕ ਗਲੋਬਲ ਸਟੇਜ 'ਤੇ ਤੁਸੀਂ ਆਪਣੇ ਨਾਲ ਤੁਸੀਂ ਇਸ ਕਾਲਜ ਦਾ, ਪੰਜਾਬ ਦਾ ਔਰ ਦੇਸ਼ ਦਾ ਨਾਮ ਉੱਚਾ ਕੀਤਾ। ਵੀ ਆਰ ਪ੍ਰਾਊਡ ਆਫ ਯੂ ਐਂਡ ਕੀਪ ਗਾਈਡਿੰਗ ਅਸ। ਸਰ ਬਹੁਤ ਸਾਰੀਆਂ ਜਨਰੇਸ਼ਨ ਤੁਹਾਡੀ ਕਿਤਾਬ ਪੜ੍ਹ ਕੇ ਪੈਥੋਲੋਜੀ ਦੀ ਡਾਕਟਰ ਬਣੀਆਂ ਔਰ ਉਸ ਤੋਂ ਬਾਅਦ ਬਹੁਤ ਸਾਰੇ ਲੋਕ ਸਪੈਸ਼ਲਿਸਟ ਬਣੇ ਆ। ਔਰ ਇਹ ਸ਼ਹਿਰ ਬਾਰੇ ਜਿੰਨੇ ਵੀ ਸਾਡੇ ਆਲ ਦਾ ਡਿਗਨਿਟਰੀਜ਼, ਅੰਮ੍ਰਿਤਸਰ ਦਿਸ ਇਜ਼ ਸਿਟੀ ਆਫ ਨੈਕਟਰ, ਇਹਨੂੰ ਜੋ ਸਿੱਖ ਗੁਰੂਜ਼ ਹੈ ਔਰ ਸਾਡਾ ਜਿਹੜਾ ਸਿੱਖਾਂ ਦਾ ਸਭ ਤੋਂ ਵੱਡਾ ਜਿਹੜਾ ਪਿਲਗ੍ਰਿਮੇਜ ਸੈਂਟਰ ਹੈ ਉਹ ਵੀ ਇੱਥੇ ਆ। ਔਰ ਇੱਥੇ ਸਾਰੀ ਦੁਨੀਆ ਤੋਂ ਔਰ ਸਾਰੀਆਂ ਸਟੇਟਸ ਤੋਂ ਲੋਕ ਆਉਂਦੇ ਆ। ਔਰ ਜਿਸ ਤਰ੍ਹਾਂ ਤੁਸੀਂ ਜਾਣਦੇ ਹੋ ਕਿ ਸਿੱਖਾਂ ਦੇ ਗੁਰਦੁਆਰੇ ਵਿੱਚ 4 ਦਰਵਾਜ਼ੇ ਹੁੰਦੇ ਆ ਕਿ ਸਾਰੇ ਪਾਸਿਆਂ ਤੋਂ ਕਿਤੋਂ ਵੀ ਕੋਈ ਵੀ ਕਿਸੇ ਵੀ ਧਰਮ ਦਾ, ਕਿਸੇ ਵੀ ਜਾਤ ਦੇ ਲੋਕ, ਕੋਈ ਰਿਸਟ੍ਰਿਕਸ਼ਨ ਨਹੀਂ ਹੈ ਅਨਲਾਈਕ ਅਦਰ ਰਿਲੀਜਨਸ। ਔਰ ਇਹਦੇ ਨਾਲ ਡਾਕਟਰ ਵਿਨੇ ਤੁਸੀਂ ਜ਼ਿਕਰ ਕੀਤਾ ਡਾਕਟਰ ਤੁਲਸੀਦਾਸ ਦਾ। ਜਦੋਂ ਦੇਸ਼ ਆਜ਼ਾਦ ਹੋਇਆ ਤਾਂ ਉਦੋਂ ਪੰਡਿਤ ਜਵਾਹਰ ਲਾਲ ਨਹਿਰੂ ਨੇ ਸੋਚਿਆ ਕਿ ਅਸੀਂ ਜੇ ਅੱਗੇ ਵਧਣਾ ਤਾਂ ਵੀ ਸ਼ੁੱਡ ਹੈਵ ਇੰਡੀਅਨ ਇੰਸਟੀਚਿਊਟ ਆਫ ਮੈਨੇਜਮੈਂਟ, ਟੈਕਨੋਲੋਜੀ ਐਂਡ ਮੈਡੀਕਲ ਇੰਸਟੀਚਿਊਟਸ। ਸੋ ਦੂਜੇ ਪਾਸੇ ਜਿਹੜਾ ਦੇਸ਼ ਸੀਗਾ ਮਤਲਬ ਫੂਡ ਗ੍ਰੇਨ ਦਾ ਬਹੁਤ ਜ਼ਿਆਦਾ ਡੈਫੀਸ਼ੀਟ ਸੀਗਾ, ਅਕਾਲ ਪੈਂਦੇ ਹੁੰਦੇ ਸੀਗੇ। ਆਈ ਥਿੰਕ ਡਾਕਟਰ ਵਿਨੇ ਹੀ ਇਜ਼ ਮਾਈ ਐਲਡਰ ਬ੍ਰਦਰ ਸੋ ਹੀ ਵਿਲ ਬੀਅਰ ਵਿਦ ਮੀ ਕਿ ਬੰਗਾਲ ਦੇ ਵਿੱਚ, ਉੜੀਸਾ ਦੇ ਵਿੱਚ ਲੋਕ ਭੁੱਖ ਨਾਲ ਮਰਦੇ ਹੁੰਦੇ ਸੀ ਹਜ਼ਾਰਾਂ ਦੀ ਗਿਣਤੀ ਦੇ ਵਿੱਚ। ਅਤੇ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਆਪਾਂ ਜਿਹੜਾ ਸਭ ਤੋਂ ਪਹਿਲੀ ਗੱਲ ਹੈ ਕਿ ਸਾਡੇ ਕੋਲ ਖਾਣ ਲਈ ਖਾਣਾ ਹੋਣਾ ਚਾਹੀਦਾ ਅਤੇ ਆਪਾਂ ਕੀ ਕਰੀਏ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਜੀ ਇਹ ਪੰਜਾਬ ਕੈਨ ਡੂ ਇਟ। ਫਿਰ ਉਹ ਪੰਜਾਬ ਵਿੱਚ ਆਏ, ਗ੍ਰੀਨ ਰੈਵੋਲੂਸ਼ਨ ਹੋਈ। ਇਟਸ ਅ ਲੌਂਗ ਸਟੋਰੀ, ਆਈ ਵਿਲ ਨਾਟ ਗੋ ਇਨ ਟੂ ਦਾ ਡਿਟੇਲਸ, ਬਟ ਵੀ ਬਿਕੇਮ ਏ ਫੂਡ ਸਰਪਲਸ ਸਟੇਟ, ਵੈਰੀ ਸਿਕਿਉਰ ਸਟੇਟ। ਉਸ ਤੋਂ ਬਾਅਦ ਇਹ ਸੀਗਾ ਕਿ ਆਪਾਂ ਮੈਡੀਕਲ ਕਾਲਜ ਬਣਾਉਣੇ ਆ। ਆਈ ਰਿਮੈਂਬਰ ਕਿ PGI All India Institute of Medical Sciences, you needed institute builders। ਤੇ ਉਸ ਵੇਲੇ ਫਿਰ ਪੰਡਿਤ ਜਵਾਹਰ ਲਾਲ ਨਹਿਰੂ ਨੇ ਅੰਮ੍ਰਿਤਸਰ ਆਏ। ਡਾਕਟਰ ਤੁਲਸੀਦਾਸ ਹੀ ਇਜ਼ ਦਾ ਫਾਊਂਡਰ ਆਫ PGI। ਸਿਮਿਲਰਲੀ ਏਮਸ ਵਾਸਤੇ ਜਦੋਂ ਵੀ ਕਿਤੇ ਕੋਈ ਮੈਡੀਕਲ ਇੰਸਟੀਚਿਊਟ ਹੁੰਦੀ ਸੀ ਤੇ ਉਹ ਕਹਿੰਦੇ ਸੀ ਕਿ ਇੱਕ ਡਾਕਟਰ ਅੰਮ੍ਰਿਤਸਰ ਤੋਂ ਲਿਆਓ, ਜਿਹੜਾ ਡਾਇਰੈਕਟਰ ਪ੍ਰਿੰਸੀਪਲ ਅੰਮ੍ਰਿਤਸਰ ਤੋਂ ਲਿਆਓ, ਬਾਕੀ ਇੰਸਟੀਚਿਊਟ ਉਹ ਬਣਾ ਦੇਣਗੇ। ਸੋ ਦੈਟ ਇਜ਼ ਦਾ ਰੈਪੂਟੇਸ਼ਨ ਆਫ ਅੰਮ੍ਰਿਤਸਰ। ਡਾਕਟਰ ਵਿਨੇ ਇਹਨਾਂ ਨੇ ਰੈਕੋਗਨੀਸ਼ਨ ਲਈ ਹੈ। ਔਰ ਇਸੇ ਤਰ੍ਹਾਂ ਮੈਂ ਕਹੂੰਗਾ ਕਿ ਡਾਕਟਰ ਨਿਰੰਕਾਰੀ, ਵੈਰੀ ਐਮੀਨੈਂਟ ਆਈ ਸਰਜਨ, ਉਹ ਵੀ ਇਹਨਾਂ ਦੇ ਸੀ ਇੱਥੇ। ਡਾਕਟਰ ਆਈ ਰਿਮੈਂਬਰ ਡਾਕਟਰ ਤੁੰਗ, ਡਾਕਟਰ ਹਰਦਾਸ ਸਿੰਘ, ਦੇ ਵਰ ਦਾ ਡੁਆਇਨਸ ਆਫ ਦੇਅਰ ਫੀਲਡਸ। ਬਹੁਤ ਸਾਰੇ ਦੂਰੋਂ ਲੋਕ ਉਹਨਾਂ ਕੋਲੇ ਦੇ ਯੂਜ਼ ਟੂ ਕਮ ਟੂ ਦੈਮ ਫॉर ਸਰਜਰੀਜ਼, ਫॉर ਮੈਡੀਕਲ ਕੇਅਰ। ਐਂਡ ਡਾਕਟਰ ਦਲਜੀਤ ਸਿੰਘ, ਹੀ ਵਾਜ਼ ਏ ਪਾਇਨੀਅਰ। ਉਹਨਾਂ ਨੇ ਜਿਹੜਾ ਇੰਟਰਾਓਕੂਲਰ ਲੈਂਸ ਉਹਦੇ ਵਿੱਚ ਉਹਨਾਂ ਦਾ ਵਰਲਡ ਕਲਾਸ ਕੰਮ ਸੀਗਾ। ਔਰ ਪੂਰੀ ਦੁਨੀਆ ਦੇ ਵਿੱਚੋਂ ਜਿਹੜੇ ਲੋਕ ਸੀਗੇ ਉਹ ਉਹਨਾਂ ਕੋਲੇ ਕੰਮ ਸਿੱਖਣ ਆਉਂਦੇ ਸੀਗੇ, ਦੇਖਣ ਆਉਂਦੇ ਸੀਗੇ ਕਿ ਡਾਕਟਰ ਦਲਜੀਤ ਸਿੰਘ, ਹੀ ਵਾਜ਼ ਏ ਆਈ ਵੁੱਡ ਸੇ ਕਿ ਵੈਰੀ ਇਨੋਵੇਟਿਵ ਪਰਸਨ। ਸੋ ਸਿਮਿਲਰਲੀ ਡਾਕਟਰ ਰਾਜਵੀਰ ਸਿੰਘ, ਨਾਰਥ ਆਫ ਦਿੱਲੀ ਸਾਡੇ ਕੋਲੇ ਰੈਟਨਾ ਸਰਜਨ ਕੋਈ ਨਹੀਂ ਹੁੰਦਾ ਸੀਗਾ, ਹੀ ਵਾਜ਼ ਦਾ ਓਨਲੀ ਵਨ। ਸੋ ਦਿਸ ਸਿਟੀ ਵਾਜ਼ ਆਲਸੋ ਨੋਨ ਐਜ਼ ਮੈਕਾ ਆਫ ਆਪਥਲਮੋਲੋਜੀ। ਸੋ ਬੜੀ ਇੱਕ ਮਾਣਮੱਤੀ ਪੋਜੀਸ਼ਨ ਹੈ ਇਸ ਮੈਡੀਕਲ ਕਾਲਜ ਦੀ। ਇਹਨਾਂ ਨੇ ਬਹੁਤ ਸਾਰੀਆਂ ਇੰਸਟੀਚਿਊਟਸ ਜਿਹੜੀਆਂ ਹੈਗੀਆਂ ਡਿਵੈਲਪ ਕੀਤੀਆਂ, ਇਨਕਲੂਡਿੰਗ PGI, ਏਮਸ ਐਂਡ ਸੋ ਮੈਨੀ ਅਦਰਸ। ਔਰ ਇਹਨਾਂ ਨੇ ਇੰਟਰਨੈਸ਼ਨਲ ਲੈਵਲ ਦੇ ਉੱਤੇ ਵੀ। ਔਰ ਤੁਹਾਡੀ ਜਿਹੜੀ ਬੜਾ ਇਹ ਬਿਫਿਟਿੰਗ ਆ ਜਿਹੜੀ ਤੁਹਾਡੀ ਕਾਨਫਰੰਸ ਹੈ, which is Indian Council of Pathology, Indian College of Pathology, and this is American Indian Pathologist of North America. Is that right? So Association of Indian Pathologists in North America. So again, you see, it's a very, I think, in the present circumstances, when the world is fragmented in the name of so many things, so you unite people because the disease doesn't know any barriers. It doesn't recognize the borders, be it smallpox, be it COVID very recently, or so many other diseases which you see they spread across borders. And why should the knowledge be limited? And this is very befitting that people across continents, they come together, share knowledge, and it benefits our generation next. which I find very few of them are here. So most of the faculty is here. So I mean, in future, I don't know. You see, when we were students, we were hungry to learn more. We will please our seniors, even when we were undergraduates. So if somebody was interested, we were always interested. If there is a conference going on anywhere, so we will never miss it. So I had expected many more students here. So anyway, and in fact, when the conference was organized, we used to work. We used to do all the work as students, you see. And that was this Guru Shish Parampara. Of course, we are talking about now digital pathology. I remember it was way back in 92. Again, another disease which spread across continents, HIV, AIDS, hepatitis. So I was very curious. I was working in PCMS in a dispensary. So I was very curious. So I wanted to know how is it coming to Punjab. There were not any injecting drug users that time. And I was wondering how come the Punjabis are getting HIV. So I did some research work on that. And for that, I met Professor Shobha Sehgal. Dr. Tamra is here. So I think that if I remember it correctly, it was immunohistopathology department or something like that. So she supported me and we did research work which was published in the international journal. So I mean, a doctor working in a dispensary and a professor in PJ could work together. So knowledge should have no barriers and it knows no barriers. And that gave me a recognition and it helped the state to formulate policies. So what you do, you see, I look inside the eye. What is happening inside the eye, and you look inside the cell, different cells of the eye, what is happening inside the ganglion cells when the light shines, you see. This knowledge comes from pathologists, and when you are looking at a tissue, there is a patient connected to it, there is a family connected to that, and there is a whole society connected to that. So what is happening in COVID, what is happening in so many novel viruses now and so many new diseases, you are the people. When I was student before that, there used to be department of eye and ENT. It was one department. Now we have 10 departments in eye itself. Vitro-retina surgeon. You see? So the time is progressing. Similarly, I think when Dr. Vinay was student, so it used to be only pathology. There was no microbiology, I suppose, that time. You see? So now there are many institutes, and even among virology and so many other institutes, and even you have so many other branches. So we have all the pioneers here, Dr. Mishra, Dr. Tamra, Dr. Ranganathan, and so many other dignitaries in front of me. And I think this is a very good platform to sharing of knowledge. You have a new kid around the block, which is AI. And I think Dr. Mishra mentioned about AI Impact Summit. And India was bitten by a Chinese AI dog. So we have to be careful about many things with AI. I think AI will replace physicians very soon, maybe in the next 2-3 years. But pathologist will be the last one to be replaced. It will take some time. So you are the most relevant doctors, even in the age of AI. So we are proud of you because you see, there is a novel called final diagnosis in a different context. You give the final diagnosis. I have been proven many times. There's no physician, there's no surgeon who has not been proven wrong by the pathologist. So you have the final say. So this is a very, I would say, responsible job as well. So I really thank my dear friend Vijay Bodal, and you see we work together. Incidentally, I worked in this institute only for a very short period, for 3 years. That was 96 to 99. I was senior resident here. I came here to learn. You see, because this was, as I said, a mecca of ophthalmology. And I did learn a little bit of vitro-retina, a little bit of more ophthalmology and the latest. And most of the people I learned from were younger than me. That's true. That will always be true. I think you people know you have to work with Gen G and maybe Gen Alpha also to learn AI from them. They will learn it much faster. So we can, you see, it doesn't know this knowledge. There are no barriers, geographical barriers or even age barriers. So there are many things which I have learned from my students. Of course, we all learn from our patients. So it's, again, you see, I congratulate Dr. Prameet Bagga, Dr. Jaspreet, all the dignitaries on the dais and all of you. And Amritsar is also, you see, known for variety of its food. And of course, you must have visited Golden Temple, Durgana Mandir, and it's a center of pilgrimage. There is a lot to learn from. The people are very hospitable. People are very, known for their, I would say, Punjabis जो असली पंजाब दी जड़ी हैगी ना, जो थानू एक्चुअल फ्लेवर है पंजाब दा, वो थानू अमृतसर च मिलेगा कि लोग बहुत प्यारे, मिलापड़े और अपने इंटरप्राइजिंग आल्सो एट द सेम टाइम. जिवें डॉक्टर विनय इज द शाइनिंग एग्जांपल ऑफ देयर एंटरप्रेन्योर एंड अदर क्लिनिकल एवरीथिंग हार्ड वर्किंग आई वुड से. So, like, I think, I understand he is in Chicago. You go to Chicago, you go to New Jersey. There are many small mini Amritsars or mini Punjabs in USA itself. Then there is a mini Punjab in Canada and many cities in England, everywhere in Europe. So you will find a small Punjab, and they are doing very well there. So let's work together. And Dr. Vinay, there were two cardiologists. Bernard Lone from USA, I wonder if you know him. And Dr. Eugene Chezev from Russia. That time USSR. It was before 1984. I was a very young doctor. We were given Nobel Prize. There is an association called International Physicians for Prevention of Nuclear War. That madness has increased. You see, you have a department of war now. So the wars are going on, the wars are raging, and the present leadership, they know how to start a war, they don't know how to stop it. So we have to write a medical prescription for them, for God's sake. Invest in health, invest in education, invest for employment. In another 10 years, we will have 1.2 billion people asking for a job. There will only be less than 400 million jobs. So 2/3 of the youth will be without job. You know what happened in Nepal. So it may not be, you see, you might think it's not important for you. I think the air we breathe, the water we drink, the food we consume, they are all toxins. They are full of cancers. They are full of other diseases. So I think you have to, because I belong to politicians and I belong to you also. I basically belong to you for the last more than 40 years. Very recently I joined politics. So I am, you see, very briefly, sir, you said we are trying to restore the glory of this institute. So now we have neuro, we have cardiac labs, we are introducing all the super specialties. So I have given a free hand to your, I would say, kids. Now it's up to them to come up to the challenge and make this once again the kind of institute where people come searching for doctors from Amritsar. So that is the challenge which we have, and you have my full support. Sir, we are working in primary care, where we have Aam Aadmi clinics, where they are available in almost every big village and every mohalla, where people can go and get medicines for common diseases, hypertension, diabetes, and all other common diseases, where 47 tests are done free of cost, 107 medicines are given. And now we have a universal health care, where every single family in Punjab will have an insurance cover of 1 million rupees, managed and funded by the government, where the person doesn't have to pay a single penny. So they can have heart bypass surgeries or anything which is managed and paid by the government, and person doesn't have to pay anything. If you meet with an accident, if you have a cancer, if you have any other debilitating disease, or you are paralyzed, so what to do? Where do you go? You start, you see, going to relatives, then maybe karza le lo, gahne bech do. You try to get the money first before you go to the doctor. So in the meantime, the disease becomes incurable. Not anymore. This is our worthy Chief Minister Bhagwant Mann ji. This is what our Aam Aadmi Party government has done it. Health and education. These are our two our priorities, and they are the most important, I would say, indicators of human development. So that's how the government should work. So we are focusing on health, we are focusing on education, and also on employment. When you have the universal health care, so there thousands and thousands of jobs will be created. If you invest same amount in defense and the same amount on education, you will get 10 times job in education or health. You will get maybe 20 times job in agriculture. But if you invest in defense, if you make intercontinental ballistic missiles, where does that money go ultimately? Those weapons become obsolete. Tanks has become obsolete. Mines has become obsolete. Armies has become nearly absolute. Now it used to be Air Force. Now even that has become, useless. So now it's the missiles and the drones. So weapon systems become obsolete very fast. Food will never be obsolete. Medicine will never be obsolete. Education will never be obsolete. So this is where the governments need to focus. And you should all be aware. You are part of that process. Doctors ਵੋਟ ਪਾਣ ਨਹੀਂ ਜਾਂਦੇ ਡਾਕਟਰ ਬਣੇ ਤੁਹਾਡੇ ਵੀ ਸ਼ਾਇਦ ਉੱਥੇ ਪ੍ਰੋਬਲਮ ਹੋਏਗੀ ਸਾਡੇ ਤਾਂ ਬਹੁਤ ਪ੍ਰੋਬਲਮ ਹੈ ਵੋਟਾਂ ਵਾਲੇ ਦਿਨ ਇਹ ਛੁੱਟੀ ਮਨਾਉਣ ਚਲੇ ਜਾਂਦੇ ਆ ਵੀ ਚਲੋ ਮਨਾਲੀ ਚੱਲਦੇ ਆ ਬੱਚਿਆਂ ਨੂੰ ਲੈ ਕੇ ਜਾਂ ਘੁੰਮ ਫਿਰ ਆਉਂਦੇ ਆ ਸੋ ਇਟ ਇਜ਼ ਅ ਰਿਸਪੌਂਸਿਬਿਲਿਟੀ ਵਿਚ ਯੂ ਮਸਟ ਰਿਮੈਂਬਰ ਸੋ ਯੂ ਹੈਵ ਟੂ ਚੂਜ਼ ਪੀਪਲ ਹੂ ਪ੍ਰਮੋਟ ਐਜੂਕੇਸ਼ਨ ਐਂਡ ਹੈਲਥ ਸੋ ਵਿਦ ਥੀਸ ਵਰਡਸ I congratulate all of you and I hope this will be the beautiful because this is also a working holiday. Yeah, and Dr. Vinay, we are very happy and pleased to say that the room you lived in and pathology lecture theatre, this will be named in your name so that people remember it. They have the curiosity. And your hostel room is already named. And this is my request to the faculty that people should know who is Dr. Vinay Kumar, what he has done it. There should be a complete description, a very brief description of that what he has achieved and what you can, if you follow in his footsteps, what you can do. So, sir, you are a guide, you are a mentor, you are the shining light for all of us. Thank you very much. I